We know Medicare can be complicated, and that you likely have questions about what kind of coverage and plan is right for you. We know you want a Medicare plan that takes care of the whole you, a plan with the right benefits and coverage, a plan that best fits you and your personal health goals. We're here to answer your questions, and we'll make sure you understand everything you need to know to choose the best plan for you. We have affordable plans to help you keep costs low, with plan premiums as low as $0 a month, and a limit on your out-of-pocket costs. Depending on the plan you choose, you could enjoy benefits like an over-the-counter allowance with as low as $0 lab services and $0 preventive services like routine screenings. Plus, help and support is here for you when you need it. We also give you essential benefits to keep you at your best, with dental, vision, and hearing coverage included in most plans. All of this comes with the strong Aetna network of trusted local doctors, hospitals, and specialists, so you get the care you need and deserve. So when you have questions, we are here to help. At Aetna, we'll be right by your side, helping you find the right plan, giving you the tools, the guidance, and all the support you need so we can make healthier happen together. Before we dive into your plan options, let's explore some important Medicare basics. There are a few important terms to help you understand your Medicare coverage. A premium is a fixed monthly amount you pay for your insurance coverage. The amount you pay is based on the plan you chose. A deductible is what you must pay for covered healthcare services or prescriptions before your Medicare Advantage plan begins to pay. A copayment, also known as a copay, is a set amount you may have to pay as your share of the cost for medical services or prescription drugs. A copayment is a set amount, not a percentage. For example, you might pay $10 or $20 for a doctor visit or a prescription drug. Coinsurance is a percentage you may have to pay as your share of the cost for services or prescription drugs. For example, you may pay 20% of the cost of a specialist visit. If applicable, the copayment or coinsurance is paid after you reach your deductible. Now that we've introduced some basic terms, let's talk about Medicare coverage options. Medicare is made up of 4 benefit parts: A, B, C, and D. Parts A and B make up Original Medicare, which is provided by the government. Part A is your hospital care, which covers services like inpatient care, skilled nursing facility care, hospice care, and home health care. Part B is your medical care. It usually requires you pay a premium, which can be deducted from your Social Security checks. It covers things like doctor visits, outpatient and home health care, and medical equipment. Part C plans are Medicare Advantage plans, which are run by private insurance companies like Aetna. These plans replace Original Medicare by providing both Part A and Part B benefits and more. Some Part C plans also include Part D coverage. We'll talk more about Medicare Advantage plans next. Part D plans offer prescription drug coverage only, which can give you extra savings. You can get Part D on its own or by choosing a Medicare Advantage plan that includes Part D. Let's talk a bit more about Medicare Advantage. Medicare Advantage coverage is a lot like Original Medicare, but often with more benefits than Parts A and B. These plans are administered by private companies like Aetna that work with the government. They often cover extra benefits like dental, hearing, and vision care too. Some Medicare Advantage plans, including many Aetna plans, even include Part D prescription drug coverage. It's no wonder Medicare Advantage plans are becoming increasingly popular. To enroll in a Medicare Advantage plan, you simply need to be eligible for Original Medicare and be in a qualifying enrollment period. We will cover enrollment periods a little later. Visit Medicare.gov to see if you qualify. But do note, you might still need to pay your Medicare Part B premium with this type of plan. There are 3 kinds of Medicare Advantage plans Aetna may offer in your area. A Preferred Provider Organization or PPO plan lets you use doctors and hospitals out of the plan's network, but you might have a higher out-of-pocket cost. In most cases, you do not need a referral to see a specialist. If you choose a Health Maintenance Organization plan or HMO, you'll use doctors in the plan's network. You might need a referral to see a specialist. With a Health Maintenance Organization with a Point-of-Service plan or HMO POS, you'll also use doctors in the plan's network, but you may go out of the network for certain services. For example, some plans allow out-of-network coverage for dental care. These plans often have a higher copay or coinsurance, and going out of network may require a referral from your primary care physician. Understanding all these different kinds of Medicare Advantage plans will help you choose yours. Do you have both Medicare and Medicaid? If so, you could qualify for a Medicare Advantage plan known as a Dual Eligible Special Needs Plan, or a DSNP. A DSNP is a Medicare Advantage plan created specifically for those who qualify for both Medicare and Medicaid. With a DSNP, you could get extra benefits that go beyond original Medicare. Talk with a representative to see if you qualify for an Aetna DSNP and if plans are available in your area. Okay, let's get into prescription drug coverage, or Medicare Part D. Knowing the 4 phases of prescription drug coverage will also be helpful to you. Phase 1 is the deductible stage. You'll be in this stage until you've reached your deductible. During this time, you'll pay the full discounted costs of formulary drugs. Phase 2 is the initial coverage stage. After you reach your deductible, you'll only pay part of the drug cost in a fixed amount. Phase 3 is called the coverage gap, or the donut hole. This phase happens after your yearly drug cost reaches $4,660. During this time, you only pay a percentage of drug costs. Phase 4 is catastrophic coverage. Once you're out of the coverage gap, you only pay a small amount for covered drugs for the rest of the year. Now that we've covered the basics of prescription drug coverage, let me tell you about our pharmacy network. A pharmacy network represents pharmacies approved by Medicare, where you are able to get your prescription drugs. Aetna has over 65,000 in-network pharmacies. More than 23,500 offer preferred cost sharing. This means that getting your prescriptions filled is convenient and even more affordable. Finding a network pharmacy close by is easy. Just check our online network directory at aetnamedicare.com. Speaking of affordable coverage, these are some of our preferred pharmacies. You'll typically pay less when you get your drugs at one of our preferred pharmacies, some of which are listed here. Just find them on our online directory. And on the off chance that you aren't close to any of them, our network includes many local independent pharmacies too. The pharmacy networks may be different on our prescription drug plans. Check with a licensed Aetna agent for details. Formularies are a list of drugs covered by your Medicare plan. Before enrolling, it's a good idea to familiarize yourself with the Aetna formulary to make sure your prescriptions are covered. But keep in mind, these lists, pharmacies, and providers can change. So it's important that you check your formulary to verify your medicines and the group that they're in, otherwise known as their tier, before starting or refilling a prescription. If your medication is not part of an Aetna formulary, the transition process may help you get a one-time fill to give you time to work with your doctor to find an alternative drug, to get any needed prior authorization, or to request a formulary exception. For the latest information, visit our website or call us 24/7 at 1-855-338-7027 to get help with your coverage. You can view our formularies at aetnamedicare.com. Just a few more things to know. Your plan could have these drug coverage rules. Some drugs require prior authorization, which is approval from your health plan before they will pay for the drugs. Your doctor must show it's medically needed for you to use a drug before the plan will cover it. You may also have quantity limits, which limit how much of a drug you can get at one time based on the drug manufacturer's recommended dosing. In some cases, you may need to follow step therapy, where in order for certain medications to be covered, you will need to try another drug first. To get more information about your specific plan, you can view your plan's formulary. It's available at aetnamedicare.com/formulary. It's important you have creditable prescription drug coverage. That means coverage that's as good as or better than what Medicare pays. In fact, it's required. The government may add a late enrollment penalty fee to your Part D premium if you don't have drug coverage. This may apply to you if you don't have creditable coverage when your initial enrollment period is over, or if there's a period of 60 days or more in a row when you don't have Part D or other creditable prescription drug coverage. As a reminder, if you have accrued this penalty and you switch plans to or from Aetna, the penalty will follow you to your new plan. You can avoid this penalty if you qualify to receive Extra Help. Extra Help is a Medicare program that helps pay some Medicare prescription drug costs, such as monthly plan premium, yearly deductible, coinsurance, copays, and coverage gap. Having limited income and resources shouldn't keep you from having drug coverage options. To see if you qualify for extra help, call 1-800-MEDICARE 24 hours a day, 7 days a week, or visit Medicare.gov. Now that you understand Medicare, it's time to enroll. In most cases, you can enroll in a Medicare Advantage plan during specific times of the year only. The main enrollment time is the annual enrollment period. This is when anyone eligible for Medicare can enroll in or disenroll from a Medicare plan. If you are enrolled in other plans, you should talk to your plan or benefits administrator before enrolling in a new Medicare Advantage plan. In some cases, joining a Medicare Advantage plan might cause you to lose your other coverage. The annual enrollment period runs from October 15th to December 7th each year. Coverage then begins January 1st of the following year. The initial enrollment period is the 7-month period that begins 3 months before you turn 65. It also includes the month you turn 65 and ends 3 months after the month you turn 65. However, this timing could be different if your birthday is on the 1st of the month. Please visit Medicare.gov for more details. If you want more information about Medicare and your options, you can download an enrollment kit. Inside this kit, you should find an Informed Choices section that explains all you need to know before choosing your plan, a Back to Basics section that explains the Medicare essentials you should know, a Closer Look section that provides a summary of your benefits and a general understanding of your coverage and responsibilities. For details, refer to the plan's Evidence of Coverage document, a Star Ratings section to learn about Medicare star ratings. We'll cover more about this on the next slide. Finally, a Rock Enrollment section to help you get started with your joining a plan. Medicare star ratings let you know about a plan's quality. Each year, CMS rates the quality of all health and prescription drug plans based on a scale of 1 to 5 stars. 5 stars is the highest quality. They use information from member satisfaction surveys, health plans, and healthcare providers to give overall performance star ratings to plans. CMS star ratings can help you compare plans based on quality and performance. You can find Aetna plan star ratings in your area by visiting our site online. Once you enroll in an Aetna plan, you'll receive your member ID card in the mail. It has the basic information you and your providers need, like your member ID number and important phone numbers. These include our customer support numbers and 24-hour nurse line, so you can get answers to your health and benefit questions anytime you need them.